big data and what we can do in Sri Lanka with in this area. um, I just want to recognize some of the key players that have partnered with me and my team here in Sri Lanka. Of course, the first person whose name I didn't put on the list is Professor Sirimali Fernando, who is the chairman of the National Science Foundation. She was the one who started all of this work that I am doing. Professor Saroj Jayasinghe from the Faculty of Medicine, University of Colombo. He is the one who actually engaged the health sector folk. And Professor Hettige from the social sciences. Professor Saman Bandara, who is the head of the Department of Civil Engineering from the University of Moratual. He is heading the transportation work group, and we'll talk about why that is important. Joining me in the room today is Dr. Indika Jagakuda from the Ministry of Health, who has been a pioneer bringing in a lot of health data, and we'll talk about some of his data sets and what we are doing with that. Janaka Mudalige from the Ministry of Law and Order. They actually happen to have a large amount of data about crime statistics, where crime is happening, where people are migrating to, and a fairly extensive data set about who is where. And Professor Prabhat Gunatilaka from the University of Peradeniya. They have done some really fantastic work where they have implemented video tracking now, where they are able to track vehicles down, whether it's a bicycle, whether it's a motorcycle, whether it is a three-wheeler on vehicles. They haven't gone to identification yet, but they can do tracking of vehicles, and this work is really fantastic, and it's now production ready. So as you can see, there are lots of players in the Sri Lankan sector working on big data and helping with this effort, which is very surprising. I think a lot of you may not know all the players who are involved in these activities, and clearly where I'm sitting here now, which is looking at the impact of big data on disasters, right? So moving along, so data, it's kind of interesting. Over the last 4 years, many places I've visited in Sri Lanka, we've talked about big data. Big data because it's a buzzword, you hear it on TV, everybody talks about it, everybody is interested about it. But I think we should just start with data, plain old data that we've had for years and years, right? And of course, data is not the same as information. Earlier in the day, I was in Dr. Jagakuda's office. We were talking about an example. If you take GPS data coming from an ambulance, what we actually have is just timestamp, latitude and longitude. That's data. It's completely uninteresting, means nothing. If we concatenate a series of these data points, then we will have an ambulance track. So now we know that an ambulance went from one location to another location. Well, that's information now, right? So data is not the same of information, and data, of course, can be transformed into information. The only reason we are talking about the big data is to extract information from this data, right? Now, what is very pertinent to this talk is that I only consider data that is in digital format. Right? Otherwise, most of everything I'm telling you is irrelevant, right? So one of the biggest problems we have is to make the data be digital and accessible, and I'll come back to that. And the next one, it's very interesting, again based on some conversations I've been having here at the Ministry of Health. We only consider data that is of reasonable quality or better, right? So every time I talk to researchers, I talk to providers of information, they will tell me that oh, some of the data is not very good. That's perfectly okay. So with big data, it is okay that some of the data is of questionable quality, and I'll talk about that a little bit later, right? So it's not necessary that the data is of best quality, right? I'll give you some examples. So if you look at satellite pictures, and if you look at the water vapor content in the clouds, which is possible today, we can have a very good data set about where it is probably going to rain based on the amount of moisture that is in the clouds. If you look at Facebook, or if you look at other social media, there will be people saying it's raining here. Right? I look at that all the time because you can see the progression of a squall line and stuff like that. It is of not the best quality, but it's still information that is valuable, because it's sometimes people just say that now it's raining and it's not raining. Let me give you another example. People look at what is searched on Google. So after the stock market closes at 5 o'clock in the evening till the stock market opens at 9:30 in the morning the next day, lots of folk will go and do searches on stocks. Hey, what about Motorola? What about this company? What about that company? So we use that data in order to predict the price of the stock the next morning. Okay. Is that best quality data? Probably not. Somebody may be looking at it for no reason. But with big data techniques, we can actually extract a signal out of that and say, oh, a lot of people are interested in this stock. Maybe the stock price will move up or down tomorrow. Right? So that's why a key thing to remember is when we talk about big data, it is data of reasonable quality, not necessarily of good quality. This morning we were talking to Dr. Jagara, and one of the things he told me was, Nimal, this data, not all of it is very good. And what we were talking about is the cause of death data, right? So if it is coming in from a hospital death record, it may be of really good quality. And there are three categories where it may not be known even, right? So purpose of this conversation and the talk that we are having, we only consider data that is connected. If the data is not connected, as in connected to a network, not really interesting, right? And as we start work, this connection could be what we call sneak connect, which is you put it on a, which is what I did 10 minutes ago here. I put it on a USB drive and took it over there because this laptop is not connected to the one that I'm using for the projection today, right? So, however, data that is in isolation, that is an island, does not lend itself to the kind of work we are talking about in big data, right? So a question for Nabil is, so why does my title of the talk start with big, right? So I've been thinking about that, right? Because as far as I'm concerned, data that meets all of these requirements can be used using techniques of big data, but it does not necessarily have to be big. So I thought maybe what I should do is say data for disaster management, right, and not necessarily big data, right? So because if you look at the population of Sri Lanka, little more than 22 million people, right? And if every one of them generate a record every day, even from actually big data point of view, what we're talking about is very tiny data. Right? Not everybody goes to hospital, not everybody gets sick, right? So even if you take all of the information we want, actually, it is very small data. Why are we talking about big data? Because with big data, now there's certain ground rules that have been accepted and normalized. That it has to be digital, it has to be connected, it has to be available, right? It has to be real time, right? If it is archived, the archived data should be accessible, right? So I thought, we'll start with saying, it's data for disaster management. That's what we're talking about, right? Now, what I'm going to next talk about is actually some of the people I recognize from in the audience, because they've been coming to some of our meetings and working with us. So what are the types of data? Especially this talk is geared towards disaster management and disaster relevant, right? So we need actually population, demographic, family size, and locale data sets, right? And why do we need that? So that we can have a baseline of where people are, what are they doing, what are the size of family, what is the age distribution of these people. Because when there is a disaster and we want to respond, those are key indicators that we can use to respond appropriately. So as you will see in all of my slides, I will put a point of contact, because one of the things I found out is that there's a dearth of information sharing in Sri Lanka. So the people who actually have this kind of information is Dr. Sunetra Pereira and Professor Hettige from the Department of Demography in the University of Colombo. Okay, so this kind of information is available today, and this office needs to have access to that information, right? What population lives, what are the population centers, what is the density, what is the family size, amongst other things, right? And when you have that kind of information, right, these are the kind of maps you can create. Right now, in this particular map, we've taken that data and we have connected it up to incidence of asthma. Dr. Jagaru's group actually produced some of these maps, right? So you can have population data, you know. And why is this important? So one of the conversations we've been having over the last month is about responding to healthcare emergencies, not necessarily disasters, healthcare emergencies. And what comes to mind is, where should we have hospitals? Where should we have healthcare providers? Where should we have ambulances? Where should we place ambulances? And we'll come back to that, right? Now, the demographic data actually extends to birth records, death records, and other records as such, right? So these kind of data is available in Sri Lanka, and Professor Hettige and Dr. Sunetra Pereira have access to all of this data, right? So this is an attempt to connect people up so that you know who to talk to. The next kind of data is electronic data that we can use to support migration. This is actually a very, very important data set. Okay, what happens, especially in Sri Lanka, when you have a disaster? We try to send help to the place where there is disaster. Well, let me ask Novil, what has happened to the people then? Some of the people have already moved out. That doesn't mean that they are well off. They are still in a disaster situation because they are probably living in a relative's or friend's house. They don't have proper sanitation. Homes are overloaded now, right? However, we only know where there has been a disaster, and we tend to concentrate the help or the disaster response to that area. Well, modern day, because almost everybody has a cell phone in their pocket, we know where they are actually to an extremely high degree of accuracy at any given time. So Janaka Abesinghe, who is the general manager Sri Lanka Telecom, interestingly did some work like this, right? So they did it not for Sri Lanka but for Haiti after the earthquake. Okay, so they looked at where people are after the earthquake. How many people? And why is this important? Because they knew where people were and how many people actually migrated from where. So so this is actually a delta, shows that a certain number of people have migrated out. And how can you use this information? Because you can now appropriately tailor and direct the disaster response, especially the health related disaster response, to areas where the people are actually living now, as opposed to where they lived 2 seconds before the disaster. Right? So this data set is available from Sri Lanka Telecom. You can get at this data. Does this data should this data be protected by privacy? What do you think? Absolutely not, because this has been anonymized. This is bulk data, right? There is no privacy violation because you have access to this data, right? So I have been working with the Sri Lanka Telecom and Dialog and others to try to have this data available not in real time but on demand when there is disaster, right? So if you have an area based on the and how it works is like this. If you look at a cell tower, look at one, there are lots of verticals, antennas on this cell tower. Each one of them is a 15-degree sector. And the way that your cell phone works is that it tries to maximize the battery power by using the minimum amount of energy or power. So the closer to the tower you are, the less energy it uses to transmit and receive. So not only that, in which 15-degree sector you are connected to the tower, because you are actually connected to one of those little vertical slots at a given time, and you also know how far away you are by the amount of energy you use to talk to the tower, right? So actually at any given time, without GPS, without anything, by the fact that you just have your phone on in the pocket, to a certain sector away from a tower, how far away in this rectangle you are actually. And it's being used for all kinds of things, like to track people, to track location, etc. Right? So you're not using GPS data, you're actually using cell tower data. And is this data available now? Yes. Is this data available electronically? Yes. It's not been asked for and it's not available. But the primary use of this data for disaster situations is it can tell you what the demographic was, how many people lived where. You can also tell whether these phones are off, because many times they don't have charging and stuff like that. But you can also see how many people's phones have moved from one location to another location. And from the data that I have looked at, from the flood data about 6 months ago, in most of those situations, actually most of the population moved to a different area, nearby different area. And their primary complaint, especially in the Kalwana area where we went and looked at, was that they had no access to help, because help went to where the disaster was, and that's not where they were living actually at that time. And so this is an important message for this group of folk to try to get access. And where I can help, obviously, as we work together, is to facilitate and make sure you get access. Extremely powerful data set, okay, which is available now. And health and health service data, I'm at the right location. I'll just show you a list of people who have been involved, that I have been talking to. Obviously, Dr. Jagado is in the audience. He is ever expanding set of OPD data that we have access to. And why is this important? We know the spreading of diseases. We know different kinds of things, and we can use that in disaster situations. For example, if there is a high concentration of chronic kidney disease, if there is a high concentration of diabetic patients, if there is a high concentration of hypertension or something like that, during disaster, when you have emergency clinics and stuff like that, what kind of medical supplies to send to these areas. Because you have this data from the OPD as to who has been coming, and you have a good idea about the health situation of the population. We have dengue data. So all these people, I'm assuming you guys know, because it's all from the Ministry of Health, that Indica has been instrumental in getting together, and a very large data set is available. We, as in myself, joining me today is Dr. Vidashan Bandara, who is one of my data scientists on my team, and we are just starting to look at some of this data that Dr. Jagoda has, and we'll talk about it at the end of this talk a little bit. And so here are some dashboards that Dr. Jagoda is producing, from different admission data, whether it's planned admission, unplanned admission, and we are just starting to look at this data in more detail now. All kinds of interesting information. And by the way, at this point in time, what are we doing? We are only doing slicing and dicing and increasing the fidelity of the information that is available. So there is data being collected every day when people go to hospitals, and an attempt has been made here very successfully to convert it to information, right? And what is the next step that we've been talking about with Dr. Jagoda is to convert it to actionable information. Let's do something now that we have this information, right? So an example of what we are looking at is to if we have this kind of information and we see a sudden increase in bowel disease in a certain area, and that there is a river or a water flow that's going through, you can predict then that downstream of that there might be an increase of bowel disease, right? It could be polluted water, it could, right? If there's a sudden increase in mosquito-borne disease, you can do something about it if you are looking at it and if you are looking ahead, right? So if you're just looking at it like we are doing today, this is actually what we call step 0, which is we look at the historical data and we produce a report and say, look what information is contained in this data. And where's Dr. Jagoda? He's somewhere in the audience, I know, right? Right. So why do we need this? We need this kind of stuff to go to our sponsors, higher up, and say, if we were looking at this data, here is what we can produce. And so this is information. Now to make it actionable, what we want to do, we want to make it be real time, right? As patients start coming in, if you suddenly see an increase in a certain type of disease, you can order the right medicine, you can make sure you have the right kind of drugs available in the pharmacy locally. So that is being actionable, right? So then there is the other side of it. If there is depletion of resources, whether it's insulin, whether it is saline or stuff like that, if there is a unnatural depletion of resources, you can get on top of that if every week is when you ordered something and now all of a sudden due to some reason or the increase, a spike in diseases or something like that, you're going to run out, you can get on top of that. So this is the advancement of use of big data, and I feel we are at the cusp of it. What do you think, Dr. Jagoda? Yeah. Right? So we are at the cusp of it, we are pulling the information together, and now we are trying to make it actionable. Right? So I would say that of all the groups that I have been working with over the last 4 or 5 years, the Health Ministry data set has been the most advanced and has been getting converted to actionable the fastest. Everything else, we made a lot of progress, and I'll touch on it a little bit, but this is where I've seen the most progress, and now what we are attempting to do is take another vector, another direction, and connect it up to something we can do, an actionable thing with the disaster response group that we are talking about here, right? So all this information is available, right? So other data, obviously, transportation data, which lots of groups are working on with you, Noel, to make it be actionable information. As you probably know, most of the traffic lights that are in Sri Lanka were developed, deployed by the University of Moratuwa, right? So the transportation group there has been very active. I've known them for about 30 years now, and Dr. Saman Bandara, who is the chairman of the Department of Civil Engineering now, he's also the head of the transportation group. Very interested, and I have connected the two of you. He will contact you to see how we can help. Obviously, National Disaster Management Center, I have to be very honest and say that it has been very difficult to understand how they participate and work on stuff. Because I track this very closely, even during this recent hurricane, for example, there was a lot of buzz whether text notification was done or not done, or how did it happen? Did we have timely notification or not? My daughter, who is in the audience here, she called me like 3-4 days before and said we are going to have a hurricane and we will have, so there's plenty of time to react, right? Thank you. High seas were predicted, long time before, right? But it didn't get out to the people. So I don't want to say that I just haven't figured out how to work with them yet. Let me just say that and stop at that. Very nice people. They actually want to work with us, but we haven't figured out how to connect them up. We also actually happen to have earth stability data, for example, soil stability data, soil saturation data, so that when it starts raining, we know which areas are going to be prone to earth slips and other natural disasters. One of the very important signals that folk like you here need in order to for preparedness. An interesting data set that should be available to everybody very readily is the weather data. However, in fact, we have had access in the United States to Katnayaka Airport readings of temperature, humidity, winds, etc. every hour on the hour. Ratnalana Airport reading every hour on the hour, but it's not available in Sri Lanka for people to get at. We have had satellite pictures and rainfall information available internationally, but when I talk to people in Sri Lanka, it's not. The interesting part about the weather data is, as part of our connection to the rest of the world, the data that the weather department, Met department collects is published on the World Weather Wire, and it is free. It's not accessible in Sri Lanka. That is the issue. It's an accessibility issue. But this data is available. We've had access to it for 35 years or more now, and we look at different aspects of it. If the Met department, you can subscribe to it, you can buy it, you can do all kinds of things to it, but this data is available. There are some interesting projects going on in Sri Lanka. Again, at the University of Moratu, I was there about 4 or 5 weeks ago, along with a research group in the Netherlands. They are actually laying out a set of towers in the Dadru-Oe basin. If you guys know your geography, you know that Dadru-Oe is one of the, because it flows in flat land, it is the most flood-prone river in Sri Lanka, right? Immediately you have, and apparently somebody taught me that Dadru means that it's unpredictable as to its path. Right? So because of that, they are going to put up about 75 monitoring stations to see the rainfall and the flood rate and stuff like that. And this project is going to get expanded, and this data is going to be available free of charge to everybody. And so you should access that. Talk to Saman Bandara. He's not the person, but it's somebody else in University of Moratu. I went and looked at the weather stations that they have developed. Very comprehensive. Has wind speed, flow rate in the river, rainfall rate, all the data. And why is this important? If it is raining, as we just discussed a little earlier, if it is raining, if it has been raining, it is going to take extra time to move logistics when there is a disaster, because the roads will be wet, because the roads may be muddy and impassable, etc. So this weather data is actually a very critical part, even though the emergency or the disaster may have nothing to do with weather. It could be a poisonous spill into a river, had nothing to do with, but the weather data is important because that will determine whether you can actually get the logistics to the right time. And Janaka Mudalige from the police has been digitizing and making available a lot of data that local police stations have. right? And they have data sometimes even more current. For example, they will know if a boulder has fallen on a road and it has made that road impassable, and if there has been an accident rendering a bridge impassable because it's blocked, right? So these are the types of data that, for the last 2 years we have been trying to connect up in order to have proactive response um, to um, disasters and unplanned events. Right? Whether it's a disaster or not a disaster, if it's a you need to have a response to it. So where are we now? We have a very good understanding of the data sets as I have laid it out to you. There is lots of historical data that is not available because it's not digital. For example, I know a professor at the University of Peradeniya. He has all the death records from 1890 till today. All the death records, every one of them, right? And why is this important? Because it will give you an idea if there is a spike in deaths, if there are different changes, right? And if you obviously had the cause of death, even if it is of dubious quality, okay. So with big data, there is this notion that you can, if you have a data set and part of that data is of very good quality and the other part you don't know the quality, right? You can segment the data into a training data set and another data set, and you can train on the training data set, which is very good data, and then qualify the dubious quality data to extract the signal from that. Right? So it's a very interesting method that has come out of big data, and so Vidarshana actually has been trying to digitize that data. We haven't made too much progress because of access issues. So obviously when there is data and it is locked up, I don't consider it data. Let me give you an example for that. Census data in Sri Lanka. So census actually locked up, as some of you have heard in my meetings here. And why is it locked up? Because it's very sensitive, right? It has not only age and other things, it has your ethnic background, for example, right? And because of that, you can only ask for a small segment of that data at a given time. So what really needs to happen, right? So folk in this room don't care about the ethnic background. They actually want to know how many people lived in a particular village. So you need to have methods by which that sensitivity and the data importance can be made available. And we've been working on that for a while. I put it in the category of the data is locked up, so as well as I consider it's not yet available, right? And as I said, there are a few initiatives that we have started. Ministry of example, making very, very good progress. That is why I'm here today. In fact, we are trying to make it accelerate even more. And as you told me last time when I was here, there is now legislation in place about electronic medical records and other things like that. I looked at that legislation. It's about, you in this room and people who are listening to me today should think that laws should be living laws. They shouldn't be dead laws. As in you don't pass it and you forget about it. You always try to keep up with technology and society and try to have updates to these laws, right? So many times, especially in Sri Lanka, we have a law and then we don't go back and revisit it, and then it becomes unusable because of technological advancements or other reasons like that. So it's a very, very good start, but it will become obsolete very soon because of new technologies coming, always trying to work around these kind of laws, and if you don't do something about it, it will be unusable. I had my one of our lawyers look at it as well, just to try to help me understand it, and his opinion was that it was very well written and covered a lot of what needs to happen as a first start. So it was awesome that you guys have done. So last couple of slides. what is next? So first thing is we really need to move from research into applications, right? So the last 2 to 3 years I've been very supporting and observing a lot of, if you look at this second slide I put up, a lot of the people are university faculty people who have got involved. And why are they involved? They are interested in research, right? But we really need to move from that to applications. What is a primary location? Where I'm sitting here today is where application is what is important. Disaster response is an application. It's not a research. It's not a, let's get the next Nobel Prize or the next patent kind of thing. It's like, let's have some solutions that are workable, because not having it is unacceptable, right? That's where we are, right? We have to use big data techniques to help convert data into information, right? And what do I mean by that? When I first did work in this area, I spent 2.5 years writing code to do analytics. Today, my daughter can do that same work in like 2 minutes in R or in Python, because all of this is available in libraries now, right? So there's NumPy, there are all kinds of libraries that you can use to do all the analytics you want, right? You don't need to be software engineers in order to do that. You need to have some basic understanding of software in order to write 10 lines of code, whether it's written in R or Python, and that's what has changed, right? So if you want to use big data techniques to convert this data that is completely useless into information, right? So if you take information that is latitude, longitude and value and convert it to a map, because you can look at it and you can see where something is hot and where something is cold. Is it actionable? I don't know. Next thing is then filter out and look at actionable information. So that's where we are, right? And obviously we need to take action, right? So all the university researchers that I'm working with, I'm pushing them from, I'm less interested in your research project, I'm more interested to see who you are partnering with, whether it is transportation, whether it is disaster management, whether it's Ministry of Health, right? And one of the action items we have from this morning is to connect up some of the folk from the universities with so in a very small way, what we are doing is we are actually going to take some action. So we have a small project that we are starting with Dr. Jagada and the planning division, right? Dr. Bandara is joining me, and another principal software architect from the US is bearing also on my team, Jim Hunter, with the software development. Vidashana will do the algorithm development, and what we are going to look at is optimal placement of ambulances and utilization of ambulances. And then as a second step, what we will do is connect up information like weather information, because the data we are going to start using for this optimal placement is the GPS data, transit data. So if I'm looking at information, and typically, I see from going from A to B to C, from a hospital to a hospital, it takes 1 hour, and all of a sudden someday it takes 2 hours, right? What is the first thing I want to look at? Has it been raining? Was it a rainy day? Right? Second thing, was there some other event of interest, like a political meeting, that roads or something like that, right? So what we, in taking small steps, what we are trying to do is look at this data that is now flowing in and try to figure out, and what did you say, Dr. Jagada, the utilization of these ambulances are now?
Yeah, it's about 20%
right.
of the time. Otherwise, it's somewhere stationed.
Right. So if we can use big data techniques, we talked about, that an ambulance will be primarily housed in one hospital, but if we can say, okay, it has a priority to help another hospital in case of emergency or need, and it is the same as having double the number of ambulances. Right? If you change the utilization from 20 to 40, because if you double the number of ambulances and keep it at 20%, you haven't moved the ball, right? So This project we are just starting now. In fact, as the data, we are going to start looking at it and try to see where we can take this data, right? So, given the time, I'm going to stop and what we are trying to do, like I said, minimize transit time to hospital as a primary mechanism, in-hospital transfers as well, and optimal use of resources, and then continuous update. And why continuous update? Any information that you collect and present is old, right? Because the process of making it presentable has made that information old, because it's now about a few minutes old, right? So continuously updating that information is very important. And we talk, things change, right? New road may be built, right? Hospital X-ray machine may be broken, and so now more people have to be transported from one hospital to another hospital, right? Things like that. And so we are going to start looking at, and I welcome anyone to join us in this effort, because the idea is, let's get moving. Right? I think you have all the resources you need as in data sets, and we have myself. I have a lot of access to artists who live abroad. I was president of LACNet for about 5 years. LACNet is a group of Sri Lankans who have a basic degree in Sri Lanka and who have done a higher degree outside Sri Lanka, who live outside Sri Lanka. So we have access to about the world, working in different places. We can call on them. They are all very willing to help. A lot of folk that work in industry, for example, a scientist who works for Procter and Gamble, he just contacted me and he said he's retiring, taking early retirement, and he would like to list of people, different kinds of experts who we can actually connect people up. Obviously, start small. That was my advice to Dr. Jagara this morning. Right? We have a plan, we have a grand vision to get over there, but let's start small. Let's get moving, and not research but application. This morning is when we do something as researchers, as scientists. One of the things we often forget, that we shouldn't forget, is we also need to produce material that we can show our sponsors, and it's very, very important, because they are the on this work. So we often forget that, and we need to produce artifacts or material. For example, we talked about, if we can say, look, if you took this ambulance and made it a secondary ambulance for another hospital, here's how the utilization may improve, because we can predict to get these projects funded and supported. Right? So that I'm going to stop right over there. Obviously, my contact, I think a lot of you know how to find me. Right? I'm nimalgamage@gmail.com. And if you have questions, I'll stop right there.
If you have any questions, please ask. And just to tell you about the amount of data that we are gathering in this unit on daily basis is immense. For example, during the disasters, we call and ask how many people have been displaced, how many pregnant mothers, how many children are there needs. I don't think at least 10% of that is converted into information. It's just a report, and we hope the person who has the report will interpret and take the action. But most of the time it stops there. Even the dengue data now, we call hospitals and find out how many data. How we interpret that data or make it useful is not really clear. So I mean, this gave a lot of insights. That's a small comment.
So I'm going to challenge you. What should we do? So you just said, we have a lot of data. What is the one thing we can do to take a small step in a different direction? So you can say, I need help with analyzing this data in real time. You can say whatever. I don't know. I'm asking you. You just stated a problem, right? We've been just talking about what something. You don't have to say it now.
Yeah.
You obviously know how to find me, right?
Yes.
What should we do, right? Because the phases are like this. We don't know we have a problem. That is the first phase. Second phase is I have a problem. Fourth phase is I have a problem, I need to do something about it, and I am doing something about it. So I think you are somewhere in the third phase area. You say I have a problem, I have all this data, less than 10% is being looked at. Right? So now I am asking the question, let's put together some programs or some pointers, right? That's what we can help a lot, right? If you need help with good obfuscation algorithms, because some of the data is personally identifiable and we should not have that. That's not my. So now the question is back to you. Since you have identified the problem, come back to me or us or Dr. Jagada, who's talking to me all the time, and say, hey, shall we start solving this problem? If you take that step,
say you are calling, when we were the hospital directors, you were calling and asking how many patients are there daily. We get really annoyed because all these, we have a lot of problems, and on top of that we have to give information to these people also. Right? Nothing happened. Right? And all the time you are asking the details. Then even we do that, even we give the details or no, nothing happens. It's a problem in the system, right? Not only you, now I am here. Right? As this is because as hospital directors, we face that problem. Right? So then you are asking, then we have to come up with some proposals or mobilize what are the requirements or something.
yeah. So in this area, for example, some of the work that Indica is doing, right, where this admission data and stuff like that is available in electronic format, right? One of the things we could do is make that be available. We can do, right? Like I said, small steps, right? You know, my previous slide, I said start small, right? Because now what you're doing is you are actually not bothering an administrator who is completely overwhelmed. There's a disaster and there are patients coming to the hospital. The last thing he wants to do is tell somebody about some count of something, right? So these are things that we can do. So I was thinking about, the definition of disaster, right, is an unplanned event of serious consequences that don't happen all the time. Right? And between the two of you, for example, there is a way to go, because you can, next question is, you can walk over and say, where is this data available electronically? I think 20 or 30 hospitals is available electronically all the time. How can I query and get that data? Happen, and they're very, very tiny, but of immense value when you need that.
Yeah, actually what we are thinking of, what we discussed there. Even now dengue epidemic, when it comes, we try to take action. But now we have a lot of OPDs computers working. If you can see the rise of something, so something is going to happen. Some sort of analytics we can use, or based on the past experience, this data and everything. So then we know that this is going to happen. Then it will save a lot of resources and it will save a lot of suffering also.
So what we told that day that Google Maps.
Google Maps, yeah.
I told you that like traffic, we saw in the Google can't they use that data, like if the data is available that covering the locations in the disaster time, can't we publish it? I don't know, legislation wise. We had the agreement with Google and we had accredited persons to update that one. That I think that can be done. That kind of help can you give, like?
But during a disaster, sometimes it is not that much practicable.
Yeah.
What I
We
feel
don't
is
know.
that because last
We
time
don't know.
investigation has send a SMS if you want help. Believe me, during the May flood, only 8 requests were received.
No.
That's true. In a person who is in a flood, how can
Yeah.
they send a SMS or whatever?
But the thing is,
No, yeah,
no, I don't know. This is
that-
sometimes that the same app.
But they say.
Same app they used to find the people who were on the rooftops, and
Yeah.
they are these people were able to go to that the Navy and all.
Yeah. That kind of, like, there are no, I mean, like, one have to get the things and do it. Like if this